Hi guys, so welcome to another day of clinical education program here at Vasantkunj, Delhi. And we have a patient today where we're going to learn the extraction of an erupted mandibular third molar. Okay, now in this patient, the third molar is erupted, but still it is covered distally with some soft tissues. So as new doctors, sometimes we are not so confident of whether we will be able to handle this case or not. So come, let's learn step by step everything about how to extract a third molar in the mandible. Plus, I'm going to tell you one secret tip of luxating this tooth.
So we start with the non-operating hand. ठीक है, अगर आप राइट हैंड से काम करते हो तो आप अपना राइट हैंड फ्री रखोगे और लेफ्ट हैंड से एक्सटर्नल ऑब्लिक रिज को पैल्पेट करेंगे ऐसे. ओके, यू विल पैल्पेट द एक्सटर्नल ऑब्लिक रिज and the area of injection is around 6 mm above the lower occlusal level. So this is the lower occlusal level and 6 mm above it from the opposite premolar. Okay, you can see here the opposite premolar. You start from the opposite premolar, 6 to 8 mm above the occlusal level. You inject and you hit bone. Okay, I am only stopping when I have hit the bone. Aspirate in two planes and slowly start injecting. Okay, keep injecting, keep pushing the syringe as you come out. Here I am using a cartridge and RT cane and I am changing the angle now. Why am I changing the angle? Because usi go mein you will be able to anesthetize the lingual nerve also. Plus, instead of a long buccal, I am giving some infiltration here because I've already given topical anesthesia or infiltration hum de rahe hain yahan par. Alright, now the next step is you will check whether the patient is symptomatic or not. I am asking the patient if there is any numbness on the chin, numbness on the lip, numbness on the half side of the tongue. And here I am checking the objective signs. Instead of asking the patient, I am putting my instrument in the premolar region and I am checking whether there is any pain or not. Her eyes will tell me whether there is pain or not. Now I start reflecting the mucoperiosteal flap here, trying to remove as much flap as I can from the third molar region. You can see there is a lot of soft tissue distal to the third molar and as much as I can from the buccal side. Okay, lingual side se zyada chedkhani nahi karni hai. You don't have to touch the lingual side much because of the lingual nerve. From the buccal side I am extracting, and this is the trick. Okay, I am using a cow horn forceps between my second and third molar. I am stabilizing my second molar with my finger, and between the second and third molar I am using my cow horn forceps. Okay, this will help to luxate my third molar tooth. Now this is one trick which comes only with clinical experience, using a cow horn between the second and third molar to luxate the tooth. Now simply using a lower molar forceps in a figure of 8 motion. Okay, आप जब मेरे साथ खड़े रहेंगे, you will be able to see how easily the tooth is popping out very smoothly. In a figure of 8 motion, you inspect whether the tooth is out completely or not. You suction the socket, you irrigate the socket, and you examine the tooth as well as you examine the socket. The socket is absolutely nice, no soft tissue trauma around the tooth. Just simple flap reflection and the third molar is out. Now we begin with closure. I will give a simple socket suture. Socket suture can be best seen when you're standing with me right there and watching me put the socket suture. So from the buccal to the lingual side near the second molar, and again same way one more time going from the buccal to the lingual side one more time. So 2 times we are crossing the suture from the buccal to the lingual, and this will give you an X kind of a suturing which is known as a socket suture. Alright.
So we've finished the procedure of third molar extraction, doing all these steps. Now it is your turn. Remember, the clinical education program is not about theory. It is all about practically doing it. So now we have around 25 to 30 patients out there waiting for tooth extraction, and each one of you get one patient, and if you can finish it in time, you get more than one patient to actually perform this procedure on yourself. So what are you waiting for? Come on, catch hold of your chair and choose your patient. You will have my help whenever you need.
For details, visit the link in the description.